That was Republican Congressman Paul Ryan talking about his budget proposal. Here to respond, he's here the whole hour, Congressman Joe Sestak, Democrat from Pennsylvania. Congressman, but one thing that Paul Ryan's, the congressman's proposal did include was some sort of Medicare reform. And I know that you understand the importance of fixing Social Security, Medicare, and Medicaid. So what do you say to that?
He's absolutely right. If we don't address mandatory spending, Social Security, which basically will go into the red, actually be bankrupt by 2039, if not even earlier because of our present economy, or Medicare, that will do so by 2019, we're going to have a massive problem. And are there ways to do it? Well, Paul says, let's just cut $1.3 trillion. Now, he doesn't say how. But what we could do, for one example, is we could stop fee for service. And this is what President Obama's health care proposal is trying to do. And so instead, what we want to do is have health preventive care. If you cover the 47 million Americans, now they're not in Medicare, but if you do the Massachusetts health care plan where competition and transparency of the standards that medical doctors, hospitals, and insurance companies have to perform to, you can discipline cost. We know, for example, today, that businesses lose $100 billion in productivity every year because of the uninsured and because of they call it present absenteeism. It means somewhere where someone comes and they're kind of sick. Now, can we do this in Medicare? Absolutely. If we are able to go in, have early care, where we find that somebody has, for example, leukemia, and we ensure they take their medicine so that they don't go to an acute stage and have to come in, we can save billions of dollars by changing the system.
But I guess part of my problem with all this is we have these long-term obligations, Medicare, Medicaid, Social Security, and the notion of helping our children today, albeit a good one, just puts off the inevitable to the next generation, and then we have to sit down and rethink this all over again. Should we stop thinking so myopically and consider a long-term plan? Because all that stuff will eventually come to fruition.
The points that were made last evening and again are brought out here are absolutely relevant. But again, I have to look at it this way, and I believe we all do. Our economic ship of state suffered a torpedo hit. This economy is just hemorrhaging jobs. This budget that President Obama did for 2010 actually tries to address that because people can't afford, as Paul Ryan's budget does, to cut food stamps. And so, and to limit unemployment compensation. We can't do that in the next year. So what we have to do is take care of today's children whose parents are being laid off. That's why in the economic stimulus bill, which is included in our bill, we covered children and their parents for 9 months of COBRA, paying 65% of their health care. And so what we want to do is get through this, patch the ship up, and then do exactly what Paul says. His principles are right. Our principles are right. We've got to come together and see pragmatically how do we approach mandatory spending. It's not tax increases or cuts right now that's causing this. What's causing it is the growth in mandatory spending. And we can do this sensibly if we come together because our budget is unsustainable by 2019. Debt to GDP ratio will be 82%, but so is every other budget proposal. We must come together to do this well together.
Cutting spending. We shall see. We're going to hold you to that. You're going to be here, though, Congressman, the entire hour. We do have the calls lined up for you to answer, and it is about answers to your questions. We promise. That is why we're here. 877